Good morning, everyone. Pat McLaughlin from 3M. I handle wound vacs, negative pressure wound therapy. I also handle patient warming, fluid warming, along with some other products at 3M, like our Avagard surgical scrub and hand antiseptic, which is what I'm here to talk to you about today. So before I get started, does anybody have any questions? It's pretty straightforward. Avagard is, again, it's our surgical scrub and hand antiseptic. It is FDA approved, the only FDA approved hand antiseptic that can be used from the first scrub of the day. And I know, Teresa, wasn't sure what your guys' protocol was in terms of like a wet scrub on the first one. I think you guys said it's
Well, I don't know if it's
per
different
clinician
for
or
everybody. You can do that, but I don't know like exactly. I haven't seen every clinician
okay.
and what they do.
So we always, even though it's FDA approved for the first scrub and every scrub thereafter, we always revert back to whatever your own, hospital protocol is in terms of the first scrub. So before the first scrub, you're going to want to use a nail cleaner. Really get under your fingernails. Okay, and then any scrub thereafter as needed, like in particular, like some examples we use if you had a messy lunch, it's probably a good idea to use a nail cleaner, again, to get under your fingernails. And then Avagard is a 3-step process. So you're going to want to pump one pump into the palm of your hand, dip your offhand into the antiseptic, work under your fingernails, flip, continue working through the hand and up your arm just past your elbow. Okay, and then essentially the same technique with your other hand. Okay, one pump, dip, working into your fingernails, flip, continue working through the hand, up your arm, and then just past your elbow. And then the third step, pump into either hand, continue working into your hands, and just up your arm, just past your wrists. So all told, it should be roughly a 90-second to 2-minute scrub, okay? You want to apply dry. There's no need for water or brushes, and you do not want to dry it. You want to let it air dry. So do not towel it off, okay? So pretty simple. Does anybody have any questions? Certainly at the end of the day, before you go home, you're probably going to want to rinse it off, especially if you've had a busy day. It can get filmy, so you're going to want to wash it off, with soap and water before you go home. But that is pretty much it. I left some instructions for any dispensers that you have, but it's relatively straightforward.
Perfect.
And I apologize. I usually bring in breakfast for these, so it's been a hectic week on my end. I did not have time to order breakfast this morning, so I told Teresa that I owe you guys. So I promise you I'll catch up with you and get you a breakfast or lunch, and I'll let Teresa know a day that I can come in and make up for not bringing anything for you this morning. All right, guys? All right, have a good day, good weekend,
Thank you so
guys.
much.
Yep.